In a sense, these medications, even though they do have a high efficacy in terms of traditional outcomes, they are only affecting a small portion of the pathophysiology of multiple sclerosis. For the most part, peripheral activation of cells, perhaps antigen presentation in the periphery, perhaps CNS penetration, but they have limited, if any, effect in direct CNS pathology in multiple sclerosis. There is a recent interest in looking at the role of other cells, particularly innate immune cells like microglial cells, and what role they play in the so-called compartmentalized inflammation in multiple sclerosis, which kind of leads to the second wave of chronic smoldering inflammation of MS. So there is a lot of hope that medications that are being currently investigated may have a direct effect not only in peripheral B cell depletion, but also in a central effect on microglial cells. Yeah, even though we've looked at traditional markers of chronic inflammation, which usually is the concept of progression independent of relapse activity, or PIRA, some MRI-based biomarkers may give us a window to look into what's happening in terms of chronic smoldering inflammation, like, for example, the presence of atrophy, whether it's global or segmental atrophy in the CNS. Certain lesional morphologies kind of speak more on that chronic inflammatory process, like the presence of paramagnetic rim around certain lesions, or the slowly enlarging lesions. So those are the traditional markers that we use currently to kind of understand that process of chronic inflammation. And then, so when looking at those markers, the currently available medications have a modest, if any, effect in those clinical as well as MRI markers, leading to this concept that that's a big unmet need, that we currently don't have therapies that directly will affect that chronic smoldering inflammation.